it's recording.
Okay, great, thank you. Okay, good afternoon everybody, and welcome to the COVID safe testing webinar that we're running as part of the BHealthy series. I'm Stacey from the Public Health team at Birmingham City Council, and just introducing the webinar today. I have with me Joanna Peasland from Birmingham Community Hospital Trust and Rachel Chapman from the Public Health team, who will lead the content of the webinar. Just before I hand over to them, we'll go through a little bit of housekeeping. So during the webinar, if you're not speaking, if you could keep your microphone muted and turn your camera off. This is just to help us with the bandwidth and to make sure that everybody can hear throughout. Also takes out any background noise as well that might be around. We very much encourage questions throughout. If you want to question, you've got something in your mind, just type it in the chat to the side, and we will pick it up and bring it in as appropriate. We might also ask you to come and speak as well. If you've got a question that you'd rather not ask in front of everybody else, feel free to email the Healthy Birmingham email address, which is on the screen now, and we'll share at the end. And as I've said already, the webinar is being recorded today, and we will be using it as a resource going forward. Just before we get started on the content, I know some of you have been to the other webinars, so I'll keep this fairly brief, but this is one in a series of webinars in the BHealthy series. The aim of the webinars is to enable you to support the communities that you're working with to reduce their risk of becoming seriously ill with COVID-19. If our microphones aren't muted, could we just do it? I'm hearing quite a bit of background noise. I don't think it's coming from my house. Thank you. So in the series, there's a whole range of webinars. We're in the COVID safe ones at the moment, so we've already got webinars that we've done on hand washing, self-isolation, meeting friends and family. We've got ones to come on getting your mind ready, healthy habits and unhealthy habits. All have expert speakers and examples of local provision where you can get involved as well. If you want to book any of the webinars, they can be found at the web link below, which is on the council website. There's also a resource to help you with a checklist for a healthier you that's there, and it's translated into 20 languages for everybody to use. So moving on, I'm going to hand over to Rachel now, who's going to take you through the next set on symptoms and what to do about testing. So over to Rachel, thank you.
Thanks, Stacey. Can you hear me? Has that worked? Yes, you're nodding, great. So just to recap, in terms of coronavirus and COVID-19, we're talking about three key symptoms: a high temperature, a new and continuous cough, and a loss or a change to your sense of taste or smell. If you experience any of these, it's really important that you isolate immediately and then look to book a test. Please don't wait to get the test or the test result before you isolate. The first most important thing to do is to isolate, because this is how you will best protect your friends and your family from COVID. So what we're going to do is talk a little bit more about getting the test. Oh, can we? Thank you. So when you need to get a test, if you have any of those three symptoms that we've just talked about, it's really important that you get a test. Equally, if you don't have those symptoms, it's important that you don't get a test. There's been quite a lot in the news over the last few days about the limited access to testing, and it's really important that we all play our part to protect the NHS test and trace service and keep it for those who really need it. It's just worth mentioning at this point that in some instances, the local authority or one of the NHS organisations might specifically ask you to get a test if we think you might be linked to an outbreak, because that will help our investigation of the outbreak. However, that will be a very specific request from us. So in any other situation, please only get a COVID test if you've got symptoms. So in terms of the pathway, if you've got any of the symptoms, then it's really important you isolate for the, isolate for the 10 days and your household needs to start their isolation period for 14 days. Then book a test, and we'll come on to that on the next slide. If you test negative for COVID, your household can stop isolating, and then once you feel better, you can also stop isolating. If you test positive for COVID, you need to continue the isolation period, and your household does, and then share any of your contacts via NHS Test and Trace. Thanks, Stacey. So in terms of how to get a test, there are two ways where you can order a test. One is through the website, which is shown there, or alternatively, you can call 119 and order one that way. Then there are two different ways of actually receiving the test, either through a postal kit or by visiting one of the test centres. If you're ordering a postal kit, you need to do this within the first 4 days. So we say for COVID, you need to be tested within the first 5 days, but for postal kits, it has to be within the first 4 days so that we've got the day to get the test kit back. The test needs to be complete by 3 o'clock on day 4 and then posted back. If it's through one of the test centres, and this is where we have been hearing about issues with people being able to get appointment slots. If you can't get a test straight away, please do keep trying. The appointment slots do get released during the day. So it's important that you just keep refreshing and keep trying to get one booked. At that point, if you can't get one, there's no point in also calling 119 because they have the same access to test slots as the website does. So the most important thing to do is just keep trying with this. It's really important that people with symptoms get a test, but just as equally, people who don't have symptoms should not get a test. If you've been advised to isolate because you've been in contact with somebody who is a confirmed case, you should only get a test if you have symptoms. If you don't have symptoms, then the test result won't change the advice that you've been given. You will still need to isolate regardless of what the test result is. So actually, getting a test, it doesn't add any extra information or help in any way. So you should only get a test if you've got symptoms. It's really important not to get a test through the NHS service if you have returned from abroad or about to travel. Again, unless you've got symptoms. If you're going back to the workplace, if you've been in contact with a confirmed case of COVID, but you haven't got symptoms yourself, or if another member of your household has symptoms, but you haven't. In any of these situations, you should not get a test. It's only if you yourself have symptoms. Thanks, Stacey. Now, the other thing we just wanted to look at is if you've been asked to isolate by NHS Test and Trace. So this is if you've been in close contact with someone who tests positive, you will be alerted to this by NHS Test and Trace and asked to isolate. And you'll be asked to isolate for 14 days after contact because it can take that long for the disease to develop. If during this time you develop symptoms, then you do need to book a test. And your household needs to isolate for 14 days. If, when you've booked your test, it's negative for COVID, your household can stop isolating, but you must still complete the 14-day isolation period because we need to be sure that you haven't caught COVID from the person you were in contact with. If you test positive for COVID-19, then you become a case. So you begin a new 10-day isolation period and your household completes their 14-day isolation period. We've got some specific guidance for schools and for employers. So schools, there is a link to official guidance on testing, which is shown here. And it's really important that this guidance is followed. Schools should not advise pupils or teachers to take a test unless they've got one of the symptoms of COVID. If there's a confirmed case in a school, then schools shouldn't be advising entire classes or year groups to get tested. Only those with symptoms, or if we've specifically asked them should they get a test. So if a bubble in a school, so either a class or a year group, has been sent home to isolate, unless anybody in that bubble experiences symptoms, they should not get tested. They should just stay at home and complete the 14-day isolation period. Schools must not require students who haven't got symptoms to provide evidence of a negative test before they let them back to school. As long as they've completed the 14-day isolation period and they haven't got symptoms, then they're absolutely fine to come back. In terms of employers, employers should not be asking members of staff to get tested before they come into the workplace. So again, if people are asked to self-isolate for the 14 days because they've been in contact with somebody with COVID, they do not need to get tested before they come back unless they themselves have symptoms. You can really help us by communicating this guidance around testing to employers or to any staff that you have. Next slide. Due to the recent rise in the number of cases in the city and the fact that Birmingham has now been placed on the national watch list, what we've actually put in place a service called Drop and Collect. And this is where we are actively going out and testing households to help prevent the spread of the virus. This is a very targeted approach in the areas where we feel it would add most benefit. So this is where we are specifically asking people to get tested to help prevent the spread. The teams will be visiting households in different areas of the city to offer test kits on the doorstep. And this is for everybody within that area to help support more testing. And this is particularly in areas where we know they're struggling to get access to testing. The residents will carry out a self-test, which Jo will be talking about in a minute. The testing is completely free, and once the test kit's been dropped off, a volunteer will come back and pick up the completed kit within the next hour. And this is helping us to prevent the spread of the virus any more widely within the city.
Thank you, Rachel. That's great. If you're staying around, so we can pick up questions at the end. So I'm now going to hand over to Jo, who's going to talk through what to expect when you have a test. Thank you, Jo.
Thank you, Stacey. So yeah, what can you expect when you have a test? So Rachel's already told you about how to book an appointment, but when you actually arrive at a test centre, what happens next? Stacey, I can't seem to move the slides on. Thank you. Okay, so you'll be greeted by some trained staff and they will give you instructions about what's going to happen. They'll explain the process and you'll get a chance to ask them any questions that you've got at that particular time. They will need to confirm personal details with you so that they can make sure that they've got the correct person that they're testing and that they've got the details to be able to get your results back to you. They then need to take a sample from your throat.
Hi, sorry, Jo. I think you're really quiet. Is there any chance you could increase your volume a little bit, please?
Is that better, Stacey, if I take that out?
Yeah, much better, much better. Thank you.
I'll start this slide again then. So when you arrive at a test centre, you'll be greeted by some trained staff. They'll explain to you what it is that they're going to do, and they'll also give you an opportunity to ask any questions that you want to ask. They will need to confirm personal details with you so that they can check that they've got the right person and that they've got the right details to get your results back to you. They then have to take a swab from your nose and your throat, and we will go into detail in the further slides of what that is. But this won't hurt. It might be a little bit uncomfortable just because you're having a swab put into an area that you're not used to having that swab put into, but actually it shouldn't be painful. When you are at the test centre, the staff will be wearing PPE, so we'd expect them to be wearing aprons, potentially a fluid shield or visor, masks and gloves as well, so you can expect that. So the throat swab itself, then you'll be asked to sit upright and tilt your head back slightly. At that point you need to open your mouth and stick out your tongue. The tester may require using a torch to see into your mouth, and they may also need to depress your tongue, as you can see on the picture there. Sometimes we do need to help people to get their tongue down so we can see where we're going. So at that point they will take a swab which gently rubs the back of your throat and the sides of your mouth. And that is how long it takes to do a throat swab. So it's literally probably only 5 or 10 seconds. Then we go on to doing your swabbing your nose. If you have got symptoms of a runny nose, which isn't one of the classic symptoms, so that wouldn't be the reason that you were there to have a test, but it may well be something that you've got alongside it, you will be asked to blow your nose on a clean tissue before the swab is taken. You'll get into the same position, so leaning your head back, and then the nurse, doctor or trained professional will put a swab into your nose. The swab will bend slightly, but they'll gently push it where it needs to go. That will then just be rotated round in your nose to take the sample. Both samples then will go off to the laboratory for testing. So just something to just mention, Rachel mentioned the self-testing. So if you are required to do self-testing, you will be given full instructions on how to do that as well.
Thank you. That was really, really clear, really helpful about to take a test. I think it's over to questions and discussion. So we've got Rachel and Joe here with us, who will stay with us till the end of the webinar. They're also, I think if we can start typing in the chat, we're asking you to consider how you could support your communities to get tests when they need tests, the messaging we've talked about earlier. So if people want to start to write some questions or any other questions that you have around testing, please feel free to. Let's see what's happening.
I think we have a call. Dave wants to ask a question.
Hello, my name's Selftesting. I'm a GP in Birmingham. I had a call off a patient who was in contact on Monday about 2 weeks ago, and he had a test on the Friday, which is day 4, which came back positive, and he obviously isolated for 10 days. He then had a repeat test as he's a taxi driver, and it's come back positive again, and he's been asked to isolate another 10 days. So he's had like a 14-day isolation period following the first swab, and now another 10 days. Is that quite common to get 2 positive results within 2 weeks?
Do you want me to answer that one, Tracy?
Yeah. Joe, are you able to help with that one?
Yeah, that's fine. So it's just to say that the way that the test is carried out is it looks for the DNA of the COVID virus. So it is possible to get a repeat positive sample afterwards. So we don't advise that anybody that has a positive result is retested within 6 weeks, because actually what you can pick up is just dead virus, so it's not causing the person a problem. The important thing is when that person has recovered, so they've done their 10-day isolation period, and returning to work should be when they are feeling well enough to return to work. They may well still have a cough after that 10-day period, or still an altered sense of taste or smell. But at that point, they're no longer classed as infectious after they've completed that period. So we wouldn't ask them to be swabbed again or isolated again.
That's what I thought. The issue, obviously, is his taxi driving firm, because he's still symptomatic, he's still got a sore throat, no fever, and the cough is easing. It's primarily the sore throat, which he said hasn't shifted. And the taxi firm obviously has requested the second test, so I don't know how he managed to get a second test if the criteria state no test after within 6 weeks.
Yeah, so I think the important thing there is that he is getting better, and I think it's just having that consistent message to him that you know, unfortunately he will continue to test positive, so it's making sure that he's done that 10-day isolation period. If he's no longer got a fever, so the fever's resolved for 48 hours, then we would say he could return to work.
Okay, thank you.
Sorry, thanks, Joe. Can I just add to that? That's why it's really important we get the message out to employers that people don't need a negative test result before they come back to work. As long as they've completed the isolation period and they've not had a fever for at least 48 hours, then they're fine to come back. Actually, another test, as in this case, is unhelpful.
It's confusing as well, yes.
Yeah, absolutely. For everybody then.
No, thank you all of you. That's a really useful question and good answers too. Thank you. We've got a couple of questions in the chat now, so we can flick over to those. So the first one is, as a school, what is the definition of extraordinary circumstances for giving one of our test kits out?
So my understanding of this is if the family have not been able to get a test kit and they're getting close to that 5 days, then that's when I would use one of those test kits. But we really do want families trying their hardest. I know the system is clogged up at the moment, but really trying their hardest to get a test kit. But if they're unable to get one, it's wherever possible, we want to support people getting tested within that 5 days.
Thank you. Hopefully that's answered that one. If you need anything else, just put another comment. Yeah, great, thank you. So we have another one from Kate. I was told an appointment is necessary for drive-through tests, but not walk-in centre. However, now everybody keeps saying you must book appointments for both. So I don't know if Joe or Rachel want to take that one. Do you want me to?
Yeah, my understanding is that you need to book an appointment for both.
Yeah, I agree too, yeah.
Yeah, likewise.
Okay, that's great. Are there any other questions? So one's just popped up. Please, could we just summarise the self-isolation periods? Rachel, are you okay to run over?
Yep. So if you've got symptoms, you self-isolate for 10 days from when the COVID symptoms started. If at the end of the 10 days you've still got a fever, you carry on that self-isolation until you've gone 48 hours without a fever. And I would say at that point, if you're still feeling unwell, it's worth getting in touch with 111 or your GP if you're still feeling unwell after that 10 days. For any contacts, they have to self-isolate for 14 days. And when they're told that they're contacts, they will be told what that 14-day isolation period is. And that includes households. So if somebody in the household is a case, they have to isolate for 10 days, but the rest of their household is 14 days. So it does go on a little bit longer if you're a contact.
Thank you, that's great. Oh, we've got a couple more popping in now. So this one's from Tina. This morning that a father has developed a cough and 2 of his children have a high temperature. What would be the process?
So it's important that they self-isolate immediately and try to get tested as soon as they possibly can. If there's anybody else in that household, they also need to self-isolate while we're waiting for the tests to be done.
Yeah, thank you. And then we've got
just to say, Stacey, that when you book on for a test, actually you can book other people on as well, so you haven't got to book 3 on 3 different occasions. So when you can get through, you can do that.
No, that's really helpful, thank you. We've got another one here. My son was sent home with symptoms and had a negative test, so returned to his school. Now he's been told to isolate again because a close contact at school tested positive. However, the rest of us don't need to isolate. I'm not sure how that works.
Yes, and that's right. So when we look at cases, we look at the immediate contacts of those cases. So the case at at your son's school, your son has been identified as an immediate contact. The rest of your family you're not direct contacts of the case. You're effectively contacts of the contact, if that makes sense. So you've got the case, then you've got your son, which is a contact, and the rest of you are contacts of your son. so you don't need to self-isolate. However, if your son develops symptoms, then you then become household contacts and he needs to get tested and you will need to isolate.
Thank you, Rachel. Okay, I'll just hover on this screen for a minute just to see if any more questions pop up whilst we're going. But I think the information today has been really clear. Is there anything that we can do to help you pass that messaging out to the communities that you're working with or groups that you're in touch with? I'm going to move on. If you do think of anything or have any questions, still pop it in the chat or just send us an email at healthybrum and we will pick it up. Where can the recording be found? That's a really good question. After the webinar, once we've downloaded everything, so probably tomorrow, everybody who's been here today will be sent an email with the link to the webinar. They'll also be on our YouTube channel as well, and all the other webinars that have already happened are there too. And you can access the webinars once they're uploaded in the same place that you booked your webinar, so the booking is replaced with the recording. I think there's just some more questions flying in as well. Will there be weekly tests for schools?
I'm not aware of it yet. Jo, I don't know if you've heard any more.
No, nothing at all around schools at the moment.
No, okay, that's great, thank you. I'm sure when more information, if that does come in, it will be publicised quite heavily. So a symptomatic person isolating for 10 days has a negative test and returns to work. Do the other household members need to remain isolating for 14 days?
No, they don't. If that person tested negative, they can go back to work once the symptoms have cleared and the rest of the household can come out of isolation.
Thank you. And then there's a question here, how can we get local community testing?
In terms of the local community testing, we're only doing that in a very directed way in areas where we identify the need is there to do that. So we don't do local community testing unless we identify there's a specific need, and that's either because we think there might be a local community outbreak or because we're doing the drop and collect there.
Okay, thank you. Right, so just as a last reminder for everybody, it's just so important to keep washing our hands, covering our face and keeping space, and just reminding everybody that you're either working with or in your families. And there's loads of different resources that you need them for use in your communities and areas. They're available mostly online, but if you can't get hold of what you need, just again, drop us an email. These are some of the other things that are doing the rounds in social media as well, and that you might be able to use on channels that you have. This one's a little bit interactive as well, so it might catch people's attentions online. And then there's the No Ball campaign that we touched on in the last webinars. That's there, and it covers all of these COVID safe messaging and just the general plea to everybody to help keep Brum safe. So the last slide there, you can see the web link to download more information, the handouts, or to book webinars, the email address for getting in touch with us about them, or the wellbeing, the BHealthy, and then an email address for any COVID inquiries as well, if you have any. I think that's all from us today. So a big thank you to Jo and Rachel for joining us and really helping share their expertise and hopefully helping us get some clear messages out and about. So yeah, I think that's all, and thank you very much and enjoy the rest of your days.